Hey future doctors, welcome back to our channel Teddy Gets You. Today in this video, we are going to discuss an important topic that is congenital and developmental cataracts. The name itself is saying congenital means before birth the child is having cataract. Okay, so what is the proper definition here? The cataract due to abnormal lens growth. So it is congenital, like before birth due to embryonic or fetal nucleus opacity. Normally the lens is transparent, because of which the light passes through it and it forms an image at the sensitive part of the retina. But here the embryonic or fetal nucleus is opacity. And in developmental you will see infancy to adolescence, it affects the deeper lens zones. So what is the reason for this congenital cataract? The mnemonic is I am her fate. I for idiopathic in 33% of cases, M for maternal causes, H for her like hereditary causes, and fate for fetal or infantile causes. So let us discuss them. Here the hereditary causes may involve systemic or may not involve systemic issues. So without systemic issues, you will see it in autosomal dominant. And with systemic disorders, they can be seen with trisomy like Down syndrome, Stickler syndrome, and cerebro-ocular facial syndrome, and Lewis syndrome, in which you will see kidney diseases. So these are the syndromes that are linked with different systems. Next one is maternal causes. The mnemonic to remember these maternal causes is MINT. M-I-N-T. M for malnutrition, which leads to jugular cataract. I for infections like torch infections, T-O-R-C-H. T for toxoplasmosis, R for rubella, C for cytomegalovirus, and H for herpes. And N for neonatal drug exposure like thalidomide and steroids, and T for teratogens like radiation. So these are the maternal causes which leads to the congenital and developmental cataracts. And now let's discuss about fetal or infantile causes. In fetal, there will be birth trauma, anoxia like low oxygen supply, and metabolic issues like galactosemia and hypoglycemia are the major causes, and they will be associated with the PHPV and retinopathy of prematurity and aniridia. PHPV is nothing but persistent hyperplastic primary vitreous. Okay. So this is a congenital eye disorder where the embryonic hyaloid vasculature fails to regress. So it potentially leads to complications like congenital cataract, microphthalmia, and leukocoria. Now let us discuss about types of cataracts. They are divided into several types like capsular, polar, nuclear, generalized, and rubella cataract. Depending on the location and the causative organism, they are divided into several types. First one is capsular cataract. In this one, anterior capsule is getting involved, so which is mild and stationary. And in posterior capsular, which is very rare, it is linked to hyaloid remnants. Next one is polar cataract. This polar cataract is also divided into two types like anterior and posterior. In anterior, you will see corneal perforation and thick white plaque, whereas in posterior, you will see onion whorl pattern. So this is the pattern you will see in the posterior polar region, and you will see corneal perforations in case of anterior polar cataract. Next one, nucleus. This nucleus is divided into several types. Example, infant, embryo, child, etc. So here you will see cataracta pulverulenta, which is powdery opacity of the lens, and you will see lamellar, which is also called as zonular, which is more common and can be seen in case of rubella infection and vitamin D deficiency. Third one is axial or sutural nuclear cataract. here you will see floral or smear and dendritic pattern of the lesions. And the last one is total nucleus. For example, if this is lens, the central part is called as nucleus and the peripheral one is called as cortex. So here there will be total involvement of this nucleus which leads to dense white opacity and severe vision loss. And the next one is generalized cataract. This generalized cataract is divided into three types. First one is coronary, blue dot and total congenital. In coronary cataract you will see club shaped and peripheral opacity. So the opacities are present at the periphery of the lens. And in blue dot cataract, the name itself is saying you will see bluish dots. And in total congenital, which is hereditary or it can be caused by rubella linked infections. Okay. So one of the dangerous and most important thing that you must remember in this topic is rubella cataract, which is caused by rubella. Here you will see pearly white nuclear opacity. For example, if this is lens, the central part is called as nucleus. In the nucleus, you will see pearly white nuclear opacity, and it is linked with rubella syndrome, mnemonic, heart, eyes, ears. Okay, heart. So there will be involvement of the heart, which leads to PDA and pulmonary stenosis. And in eyes, you will see cataract and microphthalmia. In ears you will see deafness due to damage to the organ of corti. Okay, so let me know in the comment section what is the full form of this PDA. Remember one thing, treatment always depends on the causative agent and the underlying cause. The important question is how will you manage the case? Okay, so investigations are eye examination. You will see red reflex test, slit lamp test and fundus examination. Second one, torch panels. You will see other symptoms of infections for this toxoplasmosis, rubella, cytomegalovax and herpes. The last one is blood test. In blood test, I already discussed that it is associated with metabolic issues like galactosemia and hypoglycemia. So those can be tested in your blood samples. So what are the prognostic factors here? Before that, let us discuss about treatment. So what are the indications and timing of treatment? In case of partial cataract, you will go for monitoring, and if the vision is clear, there is no use of doing surgery. And in case of unilateral dense cataracts, surgery is necessary as soon as possible, like within days of birth. Okay. So prognosis itself is depending on the treatment. You can say first one doesn't need any surgery, second one needs surgery within 6 weeks, and third one needs surgery within days. So it shows that prognosis is poor in unilateral cases due to amblyopia risk. So what is this amblyopia here? It is also called as lazy eye. So a lazy eye is reduced vision in one eye caused by abnormal visual development early in life. Okay, so the eye is lazy or weaker. So what are the surgical options here? In surgical options, you will go for extracapsular cataract extraction or lens aspiration plus posterior capsulectomy plus anterior vitrectomy. Posterior capsulectomy, anterior vitrectomy and lens aspiration. And you will also go for primary intraocular lens implantation in children who are greater than 2 years of age, and secondary IOL implantation in infants after contact lens uses. Okay, and aphakia correction in infants who are less than 2 years of age. They can use contact lenses or aphakic glasses. Children who are greater than 2 years can go for primary intraocular lens implantation, and secondary IOL implantation may be done later in infancy. So these are the important surgical points you must remember. And the prognostic factors are, there will be better prognosis when the detection is early and there are no involvement of systems and no microphthalmos. And the worst prognosis can be seen in delayed surgery and dense cataract associated with eye defects. So these are the important points that you must remember regarding congenital and developmental cataract. Hope this video helpful. Consider subscribing to the channel for more videos and interesting facts about MBBS topics. This is Harshita signing off. Thank you so much.